like to congratulate the authors on a well-written and timely manuscript on a topic for which not much robust data exists. I commonly use traditional negative pressure dressings for flap donor sites, skin grafts, and temporizing wounds. The 9 panelists on this manuscript present their consensus guidelines for the use of Instillation, negative pressure therapy, and the purpose is to suggest strategies they found successful while curtailing improper use until more studies are available. Over the past year, these devices have emerged that allow users to combine wound irrigation with negative pressure therapy. This is a decades-old concept, but in this incarnation, relatively novel and only available since about 2012. I've been surprised to see that despite its novelty or long-term efficacy data, it's been made widely available and widely utilized. In my opinion, this is a less than ideal situation, as nearly every surgeon seems to have different opinion on its proper use, such as type of instillate, dwell times, and instillate volume. Inherently, this is a level 5 manuscript based upon recommendations from a panel of 9 surgeons experienced with the device, though the reader should note they are paid consultants to the company that developed the technology. Now I want to be very clear. There is no data here that says you should use the device. However, if you do use the device, there is excellent information on how you should use it. Hopefully, after reading the manuscript, the reader will be able to curtail a significant amount of trial and error. Overall, I agree with the consensus statements. Indications discussed are varied but appropriate and are an extension of what we already practice with traditional negative pressure. I was struck by the wide range of instillates utilized, with some of the most studied unfortunately not commonly stocked in most U.S. hospitals. In this respect, the German experience is a valuable contribution to the manuscript and obviously for further investigation. Many of the consensus suggestions not only speak to proper technique, but also to pitfalls experienced by the authors, and in this regard, the manuscript is a sound technique paper as well. Ideally, recommendations on the use of Instillation therapy would be based on randomized controlled trials with appropriate follow-up period. On my wish list, I'll add quantitative analysis of wounds, perhaps PCR evaluation of biofilms to evaluate optimal technique. This technology needs head-to-head comparative data against the standard of care for a given indication, whether that's negative pressure therapy alone or dressing changes. Each technological improvement we see today comes at a healthcare cost, and this is only justified with demonstrated superiority over existing therapies. No benefit? Then not worth adopting. To this, the authors add the corollary: if you adopt, do it right. The authors have clearly defined their limitations without overstepping their task, as any claims of efficacy or effectiveness would be premature. Instillation technology has already rapidly spread at many institutions, replacing negative pressure alone devices, and in the process created more questions. The 9 consensus statements present safe and sound guidelines, but they're a start, with the expectation that more robust studies based upon scientific rigor are forthcoming.